We are going to talk about a new subject called pulmonary hypertension related to interstitial lung disease. Symptoms of ILD are very similar to that of the interstitial lung disease. There is worsening breathing symptoms, oxygen level changes, and walk test evaluation. All these things prompt towards that. Understanding the patients who develop PH-ILD have more symptom burden and worse outcome. It is important to screen ILD patients with pulmonary hypertension early after ILD diagnosis. The screening tools are pulmonary function test, breathing test, which monitor disability or progression of ILD. 6-minute walk testing monitors the patient's oxygen saturations, heart rate response to activity, and how distance they can walk. CT scans can be helpful in patients with ILD, and they don't only show the interstitial lung disease but can also show pulmonary arteries and pulmonary artery size if it's bigger. Lab monitoring would include natriuretic peptide, brain natriuretic peptide, BNP, brain natriuretic peptide, or N-terminal pro-brain natriuretic peptide, a protein released by the heart when there is high pressure. It is found to be elevated. It can indicate heart failure, can be caused by the pulmonary hypertension or by other heart problems. Echo scan of the heart is always the best tool to find out the evidence of pulmonary hypertension, but is operator dependent. Based on the suspicion from an echo, right-sided heart catheterization may require to confirm diagnosis. PH-ILD treatment often includes oxygen supplementation, pulmonary rehabilitation, medication that lower blood pressure in the pulmonary arteries. Antifibrotic agents like Perfenidone or Nintedanib can be used along with the treatment of PH-related ILD in patients with IPF or other progressive fibrotic interstitial lung disease. Immunosuppressive medication for inflammatory type of ILD, such as autoimmune disease, may also be used with treatment of PH related to ILD. The inhaled form of the medication, Treprostinil, is FDA approved for treatment of pulmonary hypertension related to interstitial lung disease. It is also approved for another type of pulmonary hypertension, pulmonary arterial hypertension, which causes narrowing of the blood vessels in the lungs. Inhaled Treprostinil, brand name Tyvaso, is inhaled directly into the lungs, where it helps blood vessel relax and open so the heart can pump blood more easily. The two ways to take inhaled Treprostinil: a nebulizer inhalation system and a dry powder inhalation, both of which are taken 4 times a day. Potential side effects could be low systemic blood pressure, coughing, headache, shortness of breath, dizziness, nausea, fatigue, diarrhea, and throat irritation. Data on a class of medication called phosphodiesterase type 5 PDE5 inhibitors such as sildenafil, tadalafil for pulmonary hypertension related to interstitial lung disease has been variable. The endothelin receptor antagonist class of medication, which is macitentan, ambrisentan, and busentan. Other medication called pyrosiguat, brand name Adimpas, should not be used to treat PH-ILD. They have been shown in clinical trials to be ineffective. Non-pharmacological treatment such as supplemental oxygen, pulmonary rehabilitation, and lung transplantation, referral for transplant evaluation is important and should be initiated promptly and appropriately.